beauty really does come from an energy, a presence. If you want to talk about just the aesthetic of beauty, I mean, symmetry is something that really makes something beautiful. It really is how you kind of wear your skin that makes you beautiful.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Jen Moran, a board-certified AACD restorative dentist focusing on cosmetic dentistry, known for blending science and art to create natural, confidence-boosting smiles. She founded Water Tower Dental Care in 1997, and after a break to raise her 4 children and beat breast cancer, she now practices there and at Hinsdale Dentistry. Dr. Jen offers general and aesthetic dentistry, including no or minimal prep veneers, same-day crowns, implants, composite bonding, whitening, Invisalign, and more, all delivered with a patient-first approach rooted in empathy, artistry, and clinical expertise. So, Dr. Moran, welcome and glad to have you here.
Thank you, Daniel. That was quite the introduction. I appreciate that.
Yeah, so let's start from the very beginning. What first got you interested in the medical field?
It's a great question. So, when I was a little kid, as far back as I can remember, I was going to be a pediatrician. And then when I took the test in high school as to what career you should have, it came up dentistry. And I honestly thought, gross, who would want to do that, right? I was, no, that's not my thing. And then while I was pre-med at U of I realized, wait a second, dentistry might be the thing for me. My dad also was working as officer friendly at the dental school in Chicago and kept telling me things like they're drawing teeth, they're sculpting, there's a lot of art involved. So this art and science combo kind of spoke to me. And then the ability to maybe have your own schedule, be your own boss, and then not have people dying. I was afraid if I was a pediatrician, I'd be walking around crying all day and sad. So that's what made me get into dentistry. I, for some reason, always wanted to be a doctor of some sort.
Okay. And so eventually you started Water Tower Dental Clinic. What made you decide to start that practice up?
So when I was an associate, so you associate at first, you work for other doctors. I did 2 years in one office, 2 years in another office, and had decided that it was time for me to own and looked at quite a few different practices. And for some reason, one or another, it just fell through or wasn't available. And I was getting to this point where I really wanted something. So 2 classmates of mine, they were opening in Park Ridge, which is a suburb, didn't have room for a third dentist, but they said they had looked at this practice in Water Tower and it might be right for me.
Mm.
So I actually called and made an offer over the phone without even seeing the practice because I knew the location. So it was really a prime location for all of the large corporations in town. It's on the Magnificent Mile. It was in an iconic Water Tower Place building with some of the top stores, and it was really a destination. So I started there, and when I walked in there, and it was like 1970. Nothing had been touched. There was shag carpeting. There was a reception area with a window that you had to open and close. It was really kind of a mess.
Mm.
What I learned was the doctor was sick, and his front desk was his nephew, and the temporary hygienist and temporary dentist that were coming in and out were working hard. So it turned out to be nice patients who loved the dentist, and he was no longer able to work it. So I had volunteered to come and work it on a regular basis, and then decided to buy it. Really, it was about the patients, the location, and just really a gut feeling because it was all DMO at the time, which is like HMO for medicine. They don't have it for dentistry anymore. It was the lowest level insurance reimbursement you could get. So it was really not the right practice to buy on paper, but in reality, it was.
Okay. Well, sounds like it was quite a journey then.
It was.
Okay, so now I want to dive a little bit deeper into some of the treatments that you provide. I want to start with the bonding and no prep veneer. So I guess let's start off with what are veneers, because I think not everyone knows what veneers are. So let's start there. What is a veneer? And then if you could talk more about what is it, like what do you do as far as like the bonding and non-prep veneers? Like what makes it
Okay.
different?
So a veneer is a porcelain. I'm sorry, I keep hitting that. A porcelain veneer is a porcelain facing that goes over the top of your tooth. So if you have small teeth and you have spaces or you need to add length, a veneer can be placed directly over your tooth without drilling on it at all. It can change the shape, it can change the color, and it really, at the end, should look like a natural tooth. You just think they have beautiful natural teeth. I have 10 across my front teeth, and mine are 16 years old.
Hmm.
They're holding up, they look great. It's kind of what got me into cosmetic dentistry,
Wow.
is my own teeth. I was born with two peg laterals, which
Hmm.
my side guys were points. So even when I
Oh.
was a kid, I had bonding, and then my first set of veneers when veneers were brand new in dental school, and this is actually my third set.
Hmm. Okay. And what is the bonding and the non-prep part of like? Is that standard? Is that not normal? Like, what's that part of the veneer side?
Bonding is when the dentist directly puts like a putty type material on your tooth and hand shapes it.
Hmm.
It's not as strong, but it can look really good. I do it on younger patients a lot. A lot of people have small laterals, which are the ones central to the mid ones. So we've got centrals and laterals. And then we'll add some length and some thickness to those with the bonding. One day, usually little to no drilling or touching on the tooth. We light cure it. They last about 3 to 5 years. They do have a tendency to chip and discolor over time.
Hmm.
So it's kind of plastic versus ceramic. Veneers are ceramic, composites are plastic, or bonding is plastic.
Okay. And what about the non-prep part of it? Is that just tied into the bonding side of it, or is it something completely different from the bonding process?
So it's non-prep is a veneer. So it's a porcelain
Hmm.
veneer, at least in
Hmm.
our office. Some guys
Hmm.
are doing composite veneers. I don't do those. I can do a composite veneer by hand, but not the ones that you send out to the lab or maybe get 3D printed.
Hmm.
But porcelain veneers, whether they're drilled to make the porcelain fit or not, are the same product. The reason we talk about non-prep now is that the newer products are very strong and very thin, so the lab can make them as little as 0.3 millimeters thick. So not everybody is a candidate for no prep veneers, but they are a real thing and they can add length and close spaces and add kind of depth if you need that.
Okay. And what do people need to be aware of when it comes to veneers? Are there certain things that they should be careful of as far as like which ones to choose or in what situations that they really need it or maybe don't need it?
That is a loaded question. So part of what you need to do when you do veneers. So you need to find a cosmetic dentist that is also functional in orientation as far as understanding how the jaw works and the bite works. If you have veneers, your bite needs to be in a position where your teeth slide properly between the upper jaw and the lower jaw, and you're not putting a lot of force on the edges. So when you have, say, we were talking about the laterals, short laterals, there's probably a reason you have short laterals because when you slide your jaw in certain positions where you're either grinding your teeth, you're speaking, or you're eating, you have a tooth that wants to slide through there. So if I add length on that, it's going to crack off or it's going to get weaker. So if your doctor has gotten your bite correctly and everything is fitting the way it should, you can eat just about anything with your veneers. However, we do tell you avoid extremely hard things. There are some like sourdough breads out there that are so hard. I would suggest you don't bite them with your veneers. Oh my
Mhm.
gosh. And if you can avoid really hard, like something like a candied apple or taffy, really hard stuff. But
Mhm.
overall, eat and drink, brush and floss as you normally would.
Got it. Okay. Now, next thing I want to go into is the Invisalign. I think
Yeah.
many people have heard of the name Invisalign, but they probably don't know what goes into it. So, but let's start off with what is an Invisalign and what can it really help people with?
Okay. Invisalign is basically braces, orthodontics, and it's done with clear trays. So we take a scan we used to take impressions, but now we take a scan of your upper teeth, your lower teeth, and your bite. We send it off to Invisalign. Invisalign is a company that then uses both AI and orthodontists to assess the case, and they give you a plan. So they will go backwards from the final product where your teeth are straight and your bite is right, and they'll tell you it'll take 15 weeks using one aligner a week. Or if you stretch it out and you want to do two aligners a week, which is a little more gentle, it'll be 30 weeks. And then they give us kind of a CAD CAM 3D projection of what the patient's teeth would look like. And now they also have something called Smile Architect, where they can take the picture of the patient's entire face and smile, and then they give us a final product of what it would look like when it's done.
Wow. Okay. And so when it comes to this process of, I'm assuming it's mostly straightening the teeth. Is that correct?
Yes,
Okay.
straightening and correcting your bite.
Okay. So what's the typical time frame people can expect when they go through this process of using Invisalign?
Today it's much shorter than it used to be.
Mm.
I'm finding on average we're between 12 and 15 weeks.
Oh, wow.
So under 4 months to
Mhm.
get straightened. Now it depends on, of course, where you start, what's happening, what your bite is like, and compliance is key. So you must wear them for 22 hours a day. You take them out to eat,
Mhm.
you clean, you put them back in again. If you're not compliant, it doesn't work. But on average, we're getting about, I'd say 14 weeks.
Wow. Okay. And so now when it comes to using this after the whole process is done, do they still need to wear them or how does that work afterwards?
Afterwards,
Mhm.
you get a retainer. So it can be a clear tray, we call or Vivera. So you get them made through the Invisalign company, and they look just like your trays that you wore during your treatment, but
Mhm.
it holds you in the final position. You can do that, or you can get a permanent retainer bonded. So we do something called a memotane, which is a laser cut, customized retainer that we would bond behind your teeth so that you can keep them straight without wearing a retainer every night.
Mhm.
And sometimes we do both. And the answer to that question is always you only need to wear your retainer as long as you want your teeth straight
Okay. Well
the
said.
rest of your life,
Yeah, there
hopefully,
you go.
right?
There you go.
Yeah. Yeah.
Okay. So now the last thing I would touch on is the full mouth rehab. What is a full mouth rehab? I think people kind of put together, well, it's you doing, I guess, fixing the entire mouth, but like what would be situations where people would need this and what's typically involved in it?
Okay. So that is usually done when somebody has had either severe wear, you've been a very, very bad clencher, and you've worn down your teeth. I've seen patients with more than 50% of their tooth structure worn down. And some of them are very young, in their 30s or their 40s.
Mhm.
So in that case, what has happened is as you wear your teeth down, your bite has called what we collapsed, right? So your lower jaws actually come up, your chin comes forward. It looks like you have no teeth when you smile because everything's small. What that requires then is kind of gently repositioning your jaw to where it would have been with full-size teeth. We design the entire mouth. Every single tooth gets a restoration. We design it in wax first, and then we slowly ease your teeth and jaw into a position where every tooth is restored, your bite is correct, your jaw now functions where it was meant to be. And then the side effect of that is really a beautiful smile where every tooth has porcelain on the front. So you've got the ideal color and the ideal shape.
Okay. So it sounds like this is kind of like a big job, or I guess that's like the impression I get. Is it typically a pretty big job that's being done when you do this?
So for full mouth rehab, it's a big job.
Mm.
Yes. So the first stage, just like any other veneer case, we do a scan, we send it to the lab. The lab and I discuss it and we design the smile. Then really the first step you get kind of like the biggest result and the biggest change. We would do 10 upper teeth and 10 lower teeth. So all the front is in the right position and looks great. And you have a beautiful temporary that will function properly. Then after all of that is finalized, you've had it permanently bonded, you've got these beautiful front teeth. Then we go back and we finish your molars. And at Water Tower, we do CEREC, which is the same day crowns. So we can do those in one visit. We can do two or three at a time. And you're sitting there for a little while, but you don't wear a temporary. And it's really nice adjunct to the full mouth rehab. Instead of once you've done the uppers and the lowers, now you have to do the premolars and or the molars, I guess, and finish that with the lab or a temporary. You don't have to wear a temper anymore.
Okay. Now, when it comes to all these treatments or even other ones that you offer, what are some of the most common misconceptions or myths you hear from your patients about what you do?
So all over TikTok, there's something about turkey teeth and the fact that every time you get veneers, we grind your teeth down to a little stump. So I hear that a lot. Do you have to grind my teeth down to a little stump? No, you do not. You can get veneers with no drilling on your tooth at all. What else do I hear? Um, that it costs so much, right? Is it expensive? I guess so. It's really up to the individual person to decide whether it's expensive or not. So I do hear that, it could be expensive, it could be painful, and hopefully it's not painful. At both offices, we take all kinds of precautions to make sure everyone is as comfortable as possible during the procedures.
Okay. And let's say that someone is looking for an aesthetic dentist, or looking to get something done aesthetically for their teeth, but they have never been to a cosmetic dentist before. What advice would you give this person so they can find the right dentist who has the knowledge, has experience, and can help them get the end result they're looking for?
That's a great question. So we all have, these supercomputers right
Mhm.
in our hands. So look it up, do your research, look at the reviews. Um, all of the large language, AI right now, the models, they have answers for you.
Mhm.
And I wouldn't trust it 100%, but if you get recommended to somebody, there's a reason, right? They are doing searches for Google reviews, Yelp reviews, mentions in media. They are kind of combing through. You want a doctor with a lot of experience. Photos, look at their photos, both on their website and in their office. You want to make sure that you can see the work that they do. You can go as far as saying, do you have a reference for me? Somebody I can talk to who's gone through the procedure. I think that's the main thing. And then they should offer a free consultation where you just come in and you talk and you meet the doctor and you see, do you think I'm a candidate? Am I not a candidate? This is what I want, and get a rough estimate of what it would cost. Most doctors offer that.
Okay. And when it comes to the educational part, how do you approach educating your patients? Because I'm sure you get some people coming in, especially for like the bigger jobs that need to be done. I'm sure there's a lot of fear. It's, oh, I'm going to drill my teeth. I'm going to drill my mouth. Like, this can be painful. How long is it going to be? So, how do you approach that educational component with your patients that they're comfortable, they understand what's going on and what's going to happen?
So everybody learns in different ways, right? So as you're speaking to a patient and they're asking these questions, you get a quick idea of whether they would like me to talk about it. Would they like to see pictures? Are they an auditory learner? Are they a visual learner? Would they like me to send them to websites so they can get all the details and all the information? Or are they somebody who is really just basing their decision on the feeling between the two of us? And if I throw too much information at them, they're going to be overwhelmed. So you get a quick feel and you have to kind of understand your patient. And I have all of them. If I do have one, because you said if they have a lot of questions, how do I educate them? I will walk them through it step by step. I'll break it down for them. We will write down phases of the treatment so they know how long each appointment will be, what it will cost, what will happen. And then for those that really like the deep dive, I tell them go out there and do some searching and research. I'll have patients come back that'll say, I was looking at the distal of number 7, and I think that perhaps my excursive, occlusion is off. And I'll be like, you've done your homework. So they come back very educated on their own.
Mhm. Okay. Now, what role do you believe creativity plays in your approach to patient care? Because I don't think when people think about dentistry, they don't think creativity is probably not the first word that comes to mind. But what role do you believe creativity plays with what you do?
So I find it very creative. There are so many shades of teeth and shapes and the texture of teeth and the characterization. So every single day I learn something new. And if you're thinking about dentistry, right, when you're painting a room and you say I'm going to paint it white, how many paint chips are they going to show you that's white? Dentistry is the same way. There is a certain like nuance to making the colors right, whether I'm doing at the lab and I'm communicating what I see to them, whether we're doing a CEREC crown at Water Tower Place and we're staining and glazing it ourselves with the Mio glazing, or when we're doing bonding, we make sure that that shade and shape and shine is all the same. And then you bring in that functional level with the bite. So there's a lot of creativity, aesthetics involved in every single tooth I work on.
Okay. And when it comes to the future, Dr. Moran, where do you think the future of dentistry is going?
I think AI, just like every other field, is coming in with a very strong presence. We are currently using it at Water Tower. And not only do we love it, the patients love it. So as we're sitting there at a consultation, I can show them, say, hey, AI flagged this area, you might have a small cavity starting. And it'll break it down and say, this tiny cavity is 90% in enamel, which is not a big problem, and 10% into dentin. So once it gets into dentin, it spreads quickly. That's something you want to address. I think AI in general is going to make my job much more efficient and really enjoyable to the patient. Because if you're somebody who wants the information very quickly, it'll be right there.
Okay. And when it comes to the future, also, what's the vision you have for your practice?
So I don't own either one of these practices
Mhm.
now. I'm an associate. So my vision right now is to just be the very best dentist I can, to learn something every single day, and then to get the word out about what we do. I love meeting patients. I love hearing their stories. Those smile makeovers are great, but sometimes that one occlusal composite, which is a biting surface composite on a back tooth on somebody who was really afraid to get anything done, is so rewarding when they're happy and it went smoothly and there's no discomfort. So for my future career, I think I'm happy to go along with these two fantastic practices and give them about 10 more years and see what happens next.
Awesome. Okay. Well, Dr. Moran, I do have one last question for you, but before I ask it, I do want to point people to your website at drjenmoran-kobes.com. Now,
Yes, yes.
last question for you. What does beauty mean to you?
Wow. Loaded question. So for me, I mean, beauty really does come from an energy, a presence. If you want to talk about just the aesthetic of beauty, I mean, symmetry is something that really makes something beautiful. Um, it really is how you kind of wear your skin that makes you beautiful. I mean, ideally, you have smooth skin and you have big eyes and you have full lips and then you have these great teeth, but a little characterization, something that makes you uniquely you, and that vibe you give off and confidence really makes beauty something special.
Okay, well, there you have it. Dr. Moran sharing her expertise. So, Doctor, if people want to learn more about you, where can they contact you? How can they find out more about you?
Well, if you go straight to my website, which is drjenmoran-kobes.com, you will be directed to either practice to learn more. You'll learn more about me, and you'll even learn about my little wellness company, which is called JMK Wellness, where you can find my products that I like. I started with only dental products because every day I was telling patients what I like and what we use. So it started there, and then it's moved a little bit into wellness and beauty, and will only grow from here.
Awesome. Well, Dr. Moran, this is great. Thank you for coming on the show and thanks for sharing your message.
Thank you, Daniel. It's been a great time.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.